Hi and welcome to InFocus. This is Jabbar Al-Ubaidi. In this episode, we will talk about medical affairs in different, or actually five countries in the continent of Africa. With me, 4 doctors and 1 psychologist. In the practice is also a doctor. So I want to turn to them to actually introduce themselves to you, and then we'll go from there. So let's start with you, Dr. Sissour.
Okay. Hello, everybody. My name is Simiso Dlamini. I am from the beautiful kingdom of Eswatini, and I'm a medical doctor.
Okay, and then we go to your colleagues.
Hello everyone, I'm Gyakuli. I'm a clinical psychologist from Mauritius.
Okay, so 2 psychologists.
Yes.
Yeah.
Greetings. I am Gundambiriko Katire. I'm a psychologist from Namibia.
Okay.
Hello everyone, my name is Paula Demba from Central African Republic. I'm a medical doctor.
Welcome, doctor.
Hello everyone, my name is Ayodeji Erubu. I'm a medical doctor. I practice as a psychiatrist from Nigeria.
Here we have it. So you have 3 doctors and 2 psychologists. So let's start with the doctors. Our audience is very interested to know about the current status of the medical situation in your countries. And the reason why I asked this question, because you guys here, to get some training through the Mandela Washington Fellowship, and you've been at least with the Bridgewater State University for almost now, we're entering the last week from the 6 weeks. And we intend to promote your need. This is legitimate cause. So we would like to see what's the status, or the current status in terms of the medical, the healthcare, health givers, and so if you can start to do, doctor.
Okay.
Which hospital, the location? Okay.
Okay, thank you for that. So I work for the largest sugar producer in Africa, which is Ilovo. So basically my hospital is private owned, but I have worked.
It's private owned?
It's private owned. So, but I have worked in the government sector for about 3 years before I moved to my current job. So the situation there mostly plagued by lack of certain resources in the form of certain medications, sometimes equipment. Mm-hmm. You find that patients have to sometimes buy certain equipment and certain medication from private pharmacies. Government doesn't always have all the resources that are required to see to everybody's health needs. But otherwise, what is different between our system in Swaziland or Eswatini is that healthcare is practically almost free. So when you compare it to the United States dollar, a consultation with a doctor will cost you about 10 cents. Yeah, so it's that cheap.
So in Swatini you have 2 systems. You have private systems.
Yes.
And that, of course, probably more expensive than the public system.
Yes, definitely.
Right?
Yes.
And that's when we say 10 cents, that's when it's come to the public.
That's the
But
public.
in the private, probably it's more than 10 cents.
It will be more than that. So in the private sector, it will be more than that, and most of the time people have so what you guys call health insurance.
Yes.
Yeah. So we call it medical aid.
Now,
so
yeah.
if they have that, then they are more likely to be able to access more specialized care and more advanced medications and treatments.
In the private setting.
In the private sector, yes.
Okay, so that's an issue.
That's well. It's
Everywhere an issue.
Everywhere it's an issue.
Yeah, even in the United States we have an issue.
Yes, yes.
But I think the public sector, because of the insurance system, as you know, the healthcare system is very expensive here.
Definitely.
But we are lucky too, because we are surrounded by great doctors and hospitals, and so the service. Sometimes when a patient go there and pay more money through the insurance, and they say, well, it's worth it.
Yes.
Yeah. So let's go to you, doctor, and in terms of your situation in your country.
Thank you very much. I work in a teaching hospital back home. It's a tertiary facility that is multi-specialty center. And I think the most objective way I can describe the medical condition is if we're able to measure the service delivery. That is, those people that need, health care, are they getting it? What's the quality that they get? So I would start by saying that from the angle of the human resources, the manpower available is very low. We are aware that WHO has postulated that, for good service delivery, we need at least 2.5 doctors and nurses to about 1,000. Currently, it's less than 1, just about 0.5 in most, African countries. My country inclusively. I work in Nigeria, by the way. So this is a great problem, and in the sense that it affects service delivery. You don't have enough people to attend to people that
So
need.
it affects the service.
It affects the service.
Yeah.
It hugely affects the service, and even the quality of the services that are delivered is something that, we feel could be improved upon. So the condition of medical service generally has not been too encouraging, and I think it's something that has been hugely affected by the exodus of health workers to my own country. These days, the syndrome is actually called Japa syndrome. Everybody wants syndrome. Yes, yeah. Everybody wants greener pasture. So, but look at it from the economic point of view, the country is losing because the great minds, the professionals are trying to go outside, to get better, skills, better, remuneration in terms of finances and other benefits, which I think these are things that we should not look away from. So that's the medical condition in the country currently.
Yeah, so we'll get to this point in terms of training, and probably we'll ask some of the hospitals if they can provide some help. And let's see, in your case, doctor.
Okay, thank you so much. What I can say is that 2 years ago, I used to work in the great pediatric hospital of my country in the capital city. Then I moved from the rural area for about 7 months, situated about 400 kilometers far from the capital city. I worked there with Doctors Without Borders in emergency care for every people. Then also a unit of intensive care for children. I can tell you that things are not easy there because we have a lot of patients and the number of the doctors are not sufficient to help all these people. So because of this organization, the condition of healthcare in this area is a little bit ameliorated for the moment.
Okay, so now we go to the psychological side of the story. So you are both psychologists. What kind of service you provide, to whom, and what are the challenges there?
Okay, so I work in a psychiatric hospital.
Yeah.
There's only one psychiatric hospital in Mauritius. It's found in the center. I work in the unit of pedopsychiatry. I work mostly with children. So the issues there is that I'm the only psychologist in that unit. So for example, I'm the only one who work with around more than 500 families, because when we work with children, we also work with a family. We can't work with the children alone. And the issues is that we have a lot of children and there's only one person, we don't have enough time. I'm in charge of doing the evaluation, the assessment, and also the therapies. And when we talk about prevention and improved quality of life for children, we talk about early diagnosis. But where I work, there's a lack of resources in terms of diagnostic tools. So we have to make do with what we have. And we rely a lot on clinical observation, which is not enough, but that's the only thing we have, so we do that. And we have a lot of psychotherapy that we do with the children. I'm also in charge of the patients who come to the hospital and also the patients who stay in the hospital. So both of them. And I think my friend also will agree that the main issue is also stigma. There's a lot of stigma around mental health. Parents are reticent to bring their children to hospital and even talk about mental health. They think that it doesn't exist. There is a huge taboo around that issue.
So we need a lot of probably raise the cultural awareness or
There is a lot of things
awareness in
that
this.
need to be done,
Yeah.
and we need a lot of support from other organizations to do that, because alone we can't do everything.
You brought a good point there,
Yeah.
so we'll come to that too. And for you, in your case,
So, sorry, I
It's
work.
okay.
I work in the Ministry of Labor. So what the Ministry of Labor is tasked with is making sure that the learners and the students and they all go after the right careers. So we do like career counseling and stuff like that. But because I'm employed by the government, I'm also available to the health ministry. Should they need any assistance when it comes to psychological interventions and stuff like that, so they request me. Also with the education ministry, because I also work with schools,
Yeah.
because most of the clients that need the career training, career testing, and all the career counseling, they're in schools. Yeah. So also I work with them. Also, my colleague mentioned stigma. That's the biggest. And what makes stigma worse in our context is because the religion, culture, tradition, it's like they separate themselves from psychology also. So that makes it worse. So if you already had stigma on your own, the moment you go to an institution, one of these two institutions, and then they tell you, if you feel sad, if you feel bad, it's just bad aura. Just take a shower and then you'll be okay. Something like that. Yeah. So that's the biggest. And one of the problems is also that a lot of people who have the problems, they decide to live with it. So we call it functional mental health. I mean, functional sickness. Let me just call it like that. Like, someone is depressed, but then they will go to work, they will do their job, they will come back home. But then they would not want to address the fact that this is not normal. I can't be this sad all the time. So people want to continue with their illnesses. Like, they don't want to admit that this is not okay.
And we have it in the United States, the same problem with stigma. So, but I want to go back to the shortage of doctors or professionals. Do you think you'll be open to doctors that they can come for short period of time or longer period of time as volunteers, and what are the conditions there? And what you can say to the doctors that now some of them they watch us and say, okay, I'm interested to go and help you there. So could you, all of you, there's a question in terms of the shortage of the specialists, the medical team, the doctor, the psychologists, and yeah, go ahead.
Okay, thank you. So the situation is a bit different from what you have in the US, in that most of our education educates one to be a general practitioner, and then they would have to go a further 4 or 5 years to be a specialist. So the situation currently in Eswatini is we do not have enough specialists, but we definitely have a lot of people who have completed medical school and are still waiting on internships. The government is not able to absorb all of them into the system at once. So we have a waiting list of almost 100 people who are qualified doctors and have been basically jobless for almost 2 years. Specialists would definitely help. If we had specialists, then we could actually use the other hospitals as training centers for them, and that way the government could be able to absorb more people. Also, financial resources to actually hire these people are very important, so if we could be able to secure that. And as for the mental health space in my country, there is not enough psychologists. We also have only the one psychiatric hospital, with only one psychiatrist. So there are psychologists there, but only one psychiatrist, and that limits the amount of help that people can get.
So if an organization like in the United States call you or email you, say I can send a team of doctors, of psychologists to work. I mean, what are the conditions there? Will be received, then you can work with them, and because the culture of volunteerism here is very high, and I'm hoping that that will happen down the road when people listen to your need in terms of human shortage, the shortage in the experts and the medical team.
Okay, just to elaborate on that, there's definitely a lot of expatriates that do work full-time in my country as specialists. There are also some organizations from the US that are already involved, like Georgetown University, there's presence. ECPAF, which is the Elizabeth Glaser Pediatric AIDS Foundation, is definitely there, and Look Commission, and other institutions that are already doing something.
So you have the practice there, and so people when they come there, they will be welcome.
They'll be welcome.
Okay,
definitely.
What any of you can jump? Yeah, go ahead.
Okay, thank you. I'm going to join my voice to my colleague because you agree with me that doing medical scholar is too difficult because of the longer of the time.
Yes.
Lot of young don't want to do this kind of school. That is why in my country, Central African Republic, we do not have lot of medical doctor. We can serve all the population, and also to make the specialization, you need money. Then after someone finish his school, he just thinking about how I can get money. So he must have money to continue the specialization. That is why in my country, we do not have a lot of specialized. And for my part, for example, I'm a generalist. I finished my study 1 year, and I want to do specialization, but for the moment I have no money. So if someone want to come in my country to help someone, medical doctor, to improve their capacity and so on, it will be a good thing for us.
You're welcome. Yeah.
Okay, let me just give a context, a local context to this also in my country. As at now, we have just a little below 100,000 registered medical doctors in Nigeria. That's a population of more than 250 million people. And as I am talking, we have just about 30,000 presently in the country. So where are the other 40,000 doctors or more doctors? So this is a reality that is obvious. Many people want something better. So I feel it's a good idea if there could be intercollaboration between doctors here in the US to come and train and all that. But I see that it is beyond that. I'm in the field of psychiatry, and we have just about one psychiatrist to 1,000 population is not enough.
Yeah.
That's huge, having just about 200 plus psychiatrists, in a country with huge population. So I feel it's about the government, all the players, all the corporate bodies, stakeholders should realize that health investment is something that is priority. I cannot quote the figure currently, but I know that the budget for health is quite low in the country, and it's something that we've been talking about. I'm not even talking about mental health right now. Sometime in 1991, there was a meeting, African Union's meeting, called in Abuja, called the Abuja Declaration, which focused on trying to, set ways to help country increase the budgetary allocation for health through government income, through partnership, through private sector investment. But here we are today, it's more like we have not really moved above the condition in 1991. So I feel that let's look at it from the beginning. Let's pump more money into health. These monies will be used to train doctors more, will be used to, equip facilities, will be used to, send doctors even abroad for training and come back. If your government is sending you out for training, you would want to come back because this government shows that they really want to invest in you. So that's the view. That's the way I see it. I'm not an administrator, but this is the way I see it,
This is a managerial kind of call. So is the same thing in your case?
So I think in Mauritius there are a number of avenues for collaboration that exist, because in Mauritius, for example, for me to study to become a psychologist, I had to go abroad. We don't have the course. So even if there is possibility for collaboration to design a course, to design a master's in psychology and counseling, clinical psychology, that will be most welcomed. And another thing is that there are also avenues for sharing expertise to design training with the Ministry of Health and even other ministries, because we have psychologists in other ministries who work with children. So that will be another possibility. And above all, if it's possible to have financial aid, for example, to buy the diagnostic tools and even to equip the hospital to make it more adapted for children.
Okay.
Yeah.
I would say I would say that the biggest need in terms of collaboration would be for research, because a lot of the information that we are applying, a lot of the theories that we are using, a lot of the things that we are using, there are things that have been theorized, developed, researched in America, the UK, Australia, and stuff like that. So if we could have collaborators, experts that will assist us in the research behind certain, even the pathologies, like the reasons these things are happening, the diagnosis, they are westernized, because that's where most of these theories are tested. That's where they are researched, and then but we implement them because that's what we are taught. So I feel like if those researchers can be brought to our level, and then we would use that research to understand our own context in terms of mental health, so that we don't diagnose our people on Western cultures. So that for me, that would be number one. And then number two would be, like, we have a university that trains psychologists. There's a undergraduate and then there's a graduate program. And the problem is when these people come out, there are no, the infrastructures to observe them, there are very few. Okay. So a lot of them, they would end up going into private. When they go to private and then they struggle a few years, and then you'll find out that they are now running their own company or they are more into business. So the mental health infrastructure, any collaboration in that would also help. Even when it is within the government, just to say, okay, on the side of gender issues, let's put a psychologist there. On the side of what, let's put a psychologist. Even if we can do that, then we'll have a lot of infrastructure to accommodate experts and collaborations. Okay,
so that's the side of human kind of source. From the conversation, I'm hearing that you probably need financial aid. Whatever that, what forms, I don't know, but financial aid is important. Would you mind like putting your contact information? So people, they can't contact you. There are donors. There are some people that they would love to help your beautiful countries and your people there. This is, as you said, it is important from the professional level, but at the same time, it is important when it comes to the lack of resources. And the lack of resources, from what I understand, is the lack of equipment sometimes, and also the lack of doctor specialists, and the lack of the financial aid. So these are the three elements or three components that probably our viewers they can take care of in terms of contacting the doctors and the psychologists and see what they can offer. Now we have less than 3 minutes. What say that you, or message that you want to deliver to our audience in terms of an immediate need to offer you if that's possible.
Okay.
So
Thank you very much. Over the last 5 weeks plus, one thing I've taken away is that health service delivery is not perfect everywhere in the world, but it has to work. There has to be measurable, a way to measure it and know that people that need it receive it. And here in the United States, despite the complaints, the difficulties and the challenges that we have been told we have seen here, we still think it is working, and we can take, a clue from this and put it into practice back home. And most importantly, I feel the medical institutions in the United States can look outside the United States and look at ways to collaborate with institutions in Africa. I would say this categorically. There could be skills training. There could be, they could offer some
so
medical
it is
courses.
training, open center. Okay.
Donations.
Yeah.
At that level, we could start from there.
Okay.
And you cannot
Okay.
tell what we can achieve from there.
Thank you, doctor. Doctor?
For my part, I can say, as a dicton used to say, a population without knowledge is a winning of soul. So just what we need is to be training.
Training.
Yes, if we can be trained, we can have a lot of knowledge again to help our country with.
And training could be online and could be in person.
In person.
Okay. Yes.
I would say any investment in mental health for me would do, whether it's exchange programs,
Yes.
research, or any kind, even finances, any kind that is going to further the agenda of mental health. For me, would be that's the need that we have.
Thank you.
I agree with you, because coming here we realize that it's only one world and we are all similar in some ways. And mental health issues is not only affecting people in developing countries but also people here. It's all over the world, so investing in that is going to be crucial if we want our people to be well and live well.
Thank you.
Thank you. I will reiterate what my colleague just said. We are one. If there's anything that I've learned in my time here, is that the issues that we have back home are also here. So
Which is
us
give you
working
confidence,
together.
It's
It does.
not like I'm alone in this fighting
It
these
does.
things or that things,
Yes.
which is really a good point. Sometimes you have this impression that everything's perfect in any particular country, but it's not.
Yeah.
But I think what we need all is to collaborate, as you
collaborate.
all said, and also understand that this need is a human need.
Yes, definitely.
Yeah, go ahead.
Definitely.
Go ahead.
So it was just that if we spend time, if we spend our resources making sure that the next person can live better through us, I think we would achieve a lot more than we are currently.
I hope so. Thank you so much for your time and also for your contribution in terms of sending the message to our viewers. And please, you see the contact information. Feel free to contact each of the doctor or the psychologist. Meanwhile, you can also email me for any question, and we can be in contact with the doctors and also the psychologists. Thank you for watching InFocus. This is Jabbar Al-Ubaidi, and we'll see you next week.